Indian and Indian subcontinent communities living in NSW. Let me extend you a very warm welcome to this highly informative session on living in a COVID world, organized by the Indian Support Center NSW, also known as ISC. My name is Priyanka and I will be your host tonight. ISC was established in March 2015 and today it has grown into a sizable organization providing a number of grassroots level community support services in the areas of family support, domestic violence victim support, digital education for seniors, and more recently, the much needed COVID 19 victim support since March 2020. The Commonwealth Government of Australia has done a tremendous job in controlling the COVID tsunami in our state of NSW, the government has done a fantastic job in controlling this dreaded disease. And today, the state has recorded a 90% double vaccination rates across the state, much ahead of the other states in Australia. While this is an excellent sign for all of us, but it is important to get unified health messages across to the communities on how to live in a COVID world. The multicultural NSW has embarked on community led initiatives that will ensure that we all know the do's and don'ts on how to manage our day to day living in a post COVID world to prevent recurrence and spread of this dreaded disease again. We are grateful to the multinational NSW for choosing the Indian Support Center as one of the organizations to spread the health messages in various languages to the Indian and Indian subcontinent communities. In our today's program, we will be joined online by the Honorary Mr. Brad Hazard, Minister for Health NSW Government, and followed by Dr. Archana Sood, a well-known infectious disease specialist in NSW. There will be an open question answer session at the end of this information session by Dr. Archana Sood. Now, I would like to invite the president of ISC, Mr. Subbarao Varigonda, to speak a few lines.
Hello, members of the Indian and the Indian subcontinent communities living in New South Wales. May I extend a warm welcome to each one of you and your families to this exciting, informative online session on living in a COVID world. For almost 2 years, the world has seen a health tsunami in the form of COVID 19. The origins could be traced from January 2020, and still the world has still not got a solid grip on this dreadful virus. Thanks to all the frontline workers, research scientists, the medical companies across the globe, we are seeing the results of their hard work today with virus under control in most parts of the world. In Australia, the governments at the state and federal level have done a lot of hard work and came out with policies to reduce the pain the communities have been going through. The NSW government has been at the forefront of battling this virus, with 95% of our state having undergone double jabs. We are still in the near normal status, although a lot of precautions still need to be taken as per advice from the health department. The Indian Support Center has done its bit for the community in addressing the issues arising out of this COVID tsunami. During early stages in March and June quarter of 2020, the ISC initiated free distribution of groceries and hand sanitizers to help financially affected families and also to reduce the spread of this virus. While the center continues its efforts in the free distribution of groceries and hand sanitizers, we have now moved in a big way into information spread in the area of living in a COVID world. Today's information session will cover most aspects of living in the COVID world, which will also include all the basics we learned in the early stages of this virus. As we move into the future, there are a number of issues we need to grapple with. Examples being booster shots, effects on vulnerable people in the society, etc. In our online session today, I encourage all of you to ask as many questions as possible to our expert speaker for the day, Professor Archana Sood. May I take this opportunity to say a big thanks to Professor Archana Sood, the well known infectious disease specialist in New South Wales, for taking time to brief us on this topic and, most importantly, tell us on the do's and don'ts of living in COVID world. Our special thanks to the Honorable Brad Hazard, the NSW Health Minister, for taking time to deliver his special message to the Indian and the Indian subcontinent community. This will follow immediately after my welcome address. I also would like to thank Multicultural NSW for choosing us as its partner for this project. Finally, my thanks to all the volunteers at the ISC and my board members for their relentless efforts in their commitment to this cause and helping the community in this hour of need. Thank you very much, and may I now hand the control back to our host tonight, Priyanka.
Thank you. Thank you, Mr. Varigonda, for your initiatives and the good work that you are doing, and of course, for your encouraging words.
Thank you.
I would really like to call upon a very special message from Mr. Bradley Hazard, who is an eminent Australian politician and who has also been the New South Wales Minister for Health and Medical Research since January 2017. Let us see what he has to tell us.
It's my pleasure to be able to say a few words tonight on this very special occasion. First of all, I'd just like to acknowledge the traditional owners of the land upon which we are all individually meeting, and thank them for their custodianship of land for many thousands of years. I also want to acknowledge Subba Rao Varagonda, the President of the Indian Support Centre, and of course the special guest speaker tonight, Professor Archana Sood from Nepean Hospital. To all of you, friends, guests, can I say it is a pleasure to be able to share with you tonight. I'm sorry that it has to be not in person, but you'd all understand why in the current times. Over the last few months, indeed possibly more than a few months, the Indian Support Centre and all of you involved have been quite incredible. I want to thank you for what you've done. In the earlier stages, the messages that you were giving before, of course, the vaccine availability was so crucial. One of the challenges that the government had, all governments have had in Australia, is to be able to reach out to our amazing multicultural community. And of course, there are many, many, many different people who make up that community. And there are many people from the Indian subcontinent, many languages from the Indian subcontinent. But you have managed to successfully reach out and convey those messages that enabled us to get a very positive response. In the early stages, of course, it was about talking to the community members about the importance of staying at home, the importance of social distancing, the importance of just taking care of each other and getting tested when you needed to get tested. And in more recent times, you have stood up well and truly and made sure that, again, through the many languages of the subcontinent, you were able to reach out to community members and to ensure that they understood the importance of getting vaccinated in this 1 in 100 year pandemic. If you hadn't done that, I'm sure that we wouldn't have had as positive a result across the community. It's clear that the Indian Support Centre has confidence, the confidence of the community. And although the government could do just so much, you were able to do so much more to make sure those messages were not only heard, but accepted, understood, and the actions then followed. So to all of you, thank you so much for the work you've done. I know many of you involved are volunteers and are doing work and have been doing work right through this difficult period, well after the days of hard work that you probably had as well, off at your own places of employment. but then doing the work and reaching out and being, if you like, the carers of the broader community. So thank you again on behalf of the government, on behalf of the Premier. You have been incredible and you've made a difference. And what more could any of us want in our lives but to make a difference to our fellow human beings? So well done. Again, congratulations and thank you.
Thank you, Mr. Bradley, for those amazing words. It really means a lot to us. But let me tell you one thing: the fight is not yet over. It's going, and we are going to get to the bottom of it. Taking on from now, let me call on Dr. Archana Sood. What do I tell about this lady? She is a senior staff specialist in the infectious disease and currently the clinical director of Division of Medicine at Nepean Hospital. She has an extensive clinical experience at her specialty and multiple research articles to her credit. Welcome, Archana, and the stage is all yours to share your information with all of us. We are very eagerly waiting for that.
Thank you, Priyanka, and thank you, Mr. Varigonda, for giving me this extending this kind invitation to me. I'm really honored to be speaking to members of my own community and hoping to sort of have a little bit of an interactive session. I've tried to keep my talk very informal. Interrupt me whenever you want to. I'm going to just talk very generally about what we know about COVID, how we've managed it, and how we should move forward. So, Priyanka, if you don't mind just putting up the first slide
Yes.
for me. And so can we just start from the start? Yeah, okay. Well, the topic that we thought we should talk about is living in the world of COVID. And I might just take you through a little bit of the history, what we know briefly about the virus, what it does to us, and then how we've managed it so far, and how should we behave going forward. So as you probably know, and I'll just leave that out slide. Thank you. As you probably know, the virus was actually first identified as a cause for a cluster of pneumonia cases in Wuhan, which is a small town in the Hubei province of China. What was known was that there was a sudden onset of respiratory illness. Patients became really very unwell, and a lot of them actually died. Very quickly, the virus was actually identified, and in this current day of genome sequencing, the scientists were able to identify the virus and its whole genome very quickly. And the best thing that they did was actually share that information across the world so that everyone could be aware of what the virus looked like and perhaps try to start and work towards managing this in the future. So this was in the end of the year 2019. At the time when this condition was so rampant in China, China did the smart thing of closing its borders very quickly to the rest of the world as the disease was spreading very rapidly. However, we did not really escape it, as we all know by now. Soon there were cases identified in Thailand, in Vietnam, and across Europe, and then in USA, and of course it then came to the shores of Australia. The designated disease was called COVID-19, which is basically a form to say coronavirus-induced disease. And because it was found, it first appeared in 2019, the suffix 19 was added to that. In February 2020 is when this name was actually allocated, and this is what we know the disease as by now. And very shortly thereafter, as I said, the disease was found to be present in many parts of the world, and it was declared a pandemic and an emergency, and the whole world was now preparing to see what it could do to control the disease. What was also quite easily understood was that it was a respiratory virus, so really spreading very quickly through people's breathing. So all the preventive measures that were required were very quickly worked out. It was also feared at the time that it spreads by touch, and that became a big part of our prevention policies very early on in the day. Can I see the next slide, please? So just briefly to tell you what the SARS, you would have heard the word SARS associated with this condition and the virus very often. And SARS is basically a mnemonic that stands for severe acute respiratory syndrome, which basically just means that this virus causes a disease that is associated with very significant respiratory or lung disease. This is not the first virus that we've known in this family. The initial SARS virus was the SARS-CoV-1 or the coronavirus 1, which started in 2003, which was first found in 2003 to cause significant pneumonic disease in Asia. As you might remember, Singapore was the most affected city or country at the time. And also it did occur, the disease did spread to the USA, to other parts of Asia, and also parts of Europe. Luckily, at the time, Australia did escape. However, that epidemic or did not actually end up as being a pandemic, though it was quite significant. The mortality rates were quite high with that condition as well. It was very, very quickly controlled and did not recur till quite some time later when the Middle Eastern respiratory virus turned up, which was the same family of coronavirus, and that was called the MERS-CoV. The MERS-CoV got controlled even faster, and actually people think that it got attenuated, which means it became less severe as it mutated and therefore just died its own death. Not so the SARS-CoV-2. So the SARS coronavirus 2 is another variant of the same virus that has now, as you know, played such havoc across the world. It is an RNA virus, and it's quite a large strand of RNA, which is part of the genome of the virus. Not to go into too much science, but I do want to say that the virus has about 4 or 5 proteins that it produces. The most important protein is the S protein or the spike protein, which is represented by these red knobs on the virus. The virus is actually a spherical virus and has these projections on it, which are basically the parts of the virus that attach themselves to the human cell. And that's how they enter our respiratory system. Very quickly, it was also understood that it is antibodies against this protein that can actually help to prevent formation of disease. And much of the work in the vaccine development and much of the work in the antibody development has gone into producing antibodies against this particular protein. There are other proteins that the virus does produce, but much of those proteins, which are labeled M, N, H, E, and E, are basically part of the structure that is needed to make the virus itself. The importance of knowing these proteins is that it does help in diagnosis, and I won't really go into details of that, but that's what we use these names for. What we know very well is that this family of viruses is actually quite widespread and very much more among animals than humans. As you might know, the origins of this disease have been hotly debated. What we do know and what we do believe is that it arose from the wet markets of China, from bats, and bats have been the primary host. And part of the migration of the virus has been because of some of the exotic food habits that occur in that part of the world, and how the wet markets are quite open and lots of people pick up their food where there, and the bats are supposed to have then transmitted the virus to humans because of a certain mutation that made the virus now infect human beings. There have been, as you know, a lot of theories of conspiracy, humanly produced virus, human mutations, a laboratory experiment gone wrong, or an escape of a virus from a laboratory. All have been unproven so far, including from the report of a large team of WHO doctors and scientists, including people from Australia, quite eminent public health specialists, who went and investigated this process and have not found any evidence of foul play, to be honest. Can I have the next slide, please? So, no, the previous one, thanks. Thank you. So much as we know that the virus does spread from breathing, and the reason we know that is that the primary disease that it produces is lung disease, and obviously it is inhaled, and therefore that's the most important route of spread that we need to worry about. It was quite quickly established that when you have face to face contact with an infected individual, that's when you're likely to get infected. There are two types of breathing type of respiratory spreads that can occur. One is through droplet, and the other, what we call, is airborne. And both modes of transmission are through inhalation of the virus. Basically, the transmission just means the size of the particle that can enter and that can carry the virus, and how long it can stay suspended in the air. So how long can do you have to be in contact with the person to be able to have that risk of infection. What we know about the SARS-CoV-2 virus is that if there is face-to-face contact of less than 1.5 meters for at least 15 minutes, that is when we say that is a significant contact. So that is just for some information on how to determine whether you have been at risk of getting an infection from another individual who may be positive. Most of the time, people will remain asymptomatic for sometimes for the entire period of the illness. However, most people will get an infection within about 4 to 5 days after an exposure. That is known as the incubation period, which means the time from when you came in contact with the virus to the time when you developed an infection. So about 4 to 5 days after your exposure, you're at risk of getting the infection or showing the signs of infection, but this can extend up to 14 days, which is the reason why most of the time when we are given isolation advice, it is extended to 14 days, because we expect that anybody who has been exposed to the virus and has no symptoms by 14 days means they don't have the infection, because otherwise they would have shown up the virus by now. Most people will have symptoms by about day 10. So realistically, if you are asymptomatic by day 10 and everything else is well, then you're not likely to be infectious to others. However, we do extend that to 14 days even now. As I said, a large number of people can remain asymptomatic, particularly by now when most people are vaccinated. The risk of developing symptoms are quite low. But even in unvaccinated people, about 80% of people will have very mild disease. So very minor symptoms, just a little bit of a cold, maybe some cough, may or may not be mild fever, and usually they will resolve by itself. And if we did not know we are part of a pandemic, we might not have even known that they were significantly unwell. So just like another common cold, maybe. About 10 to 14% people will develop what we call severe disease. So severe diseases can be in many manifestations, and I'll come to that in a minute, but mostly pneumonia and mostly a drop in their level of oxygen levels because of the severe pneumonia this condition can cause. And about 5% of people will develop critical illness, which means they will require intensive care admissions, they may require ventilation, and the oxygen levels are very, very poor, and they may do quite poorly. The whole disease has about 2 to 5% mortality rates. So really, the numbers seem very small, but as everyone has seen, in actual fact, millions of people have actually died of the viral infection across the world, because even 2 to 5% of population in a very highly infectious condition actually comes to a sizable number of people. Next slide, please. So just coming to the symptoms are usually, they can start in a very minor way. So about day 4 to 5 of exposure, somebody may develop a cough, a little bit of fever, some aches and pains like any other viral condition, some headaches. However, the more significant symptom is that of shortness of breath. Some people will develop a diarrhea, some nausea, some vomiting, and prominently, some people will develop a lot of loss of smell and taste, with maybe some abdominal pain. On the right hand of this slide, I have actually compared the symptoms of COVID-19 with some common cold and flu, just to see which symptoms are more common in which condition. And this is because the viruses that cause all three conditions are quite similar in their spreading style, and some of them in their structure as well, and their presentation. So as noted here, the aches and pains that are very common with flu are not so common with COVID-19. Cough is quite common in both conditions. Diarrhea is rare in both conditions. Both conditions cause some fatigue, but flu causes a lot more fatigue than COVID-19 does. Having said that, the duration of fatigue can really be extended with COVID-19 disease. Fever is quite common in both. It's quite rare in common colds. Headaches are only occasional in COVID-19. They are very much more common with common colds and with flu. You may get a runny or stuffy nose, which is much more common with common colds, but sometimes also with flu. The shortness of breath is the one that occurs much more often with COVID-19 than with the other two conditions. There's not that much sneezing. There is some sore throat, and some of the other symptoms that I have mentioned can also occur. Next, please. Next slide, please. So we did talk about severe disease, which is not really very common. It occurs only in a very small percentage of people. But however, when it does occur, it can be quite distressing. But we do know there are some risk factors for developing severe disease, and not everyone is at the same risk. As you've already seen, the younger generation, children, etc., are not at such a risk of severe disease as the older people. Having said that, that doesn't mean that it can't occur. However, if we just look at the percentage, the older the patient is, the higher the risk of severe disease, and over 70, that risk increases quite significantly. People who have other underlying conditions, like significant diseases like cancer, diabetes, some underlying lung diseases that are related to smoking, if they have kidney failure, they have significant heart conditions, particularly heart failure, obese people, pregnant women, people who have strong history of smoking, and some people who are quite significantly immune suppressed. So, for example, people who've had transplants or who have some blood disgrace, blood conditions, etc., they are at a much higher risk of severe disease than any normal young individual who has no other underlying condition. And the severe illness usually takes the form of what we call respiratory failure, which basically means the patients have significant pneumonia and their oxygen levels are very, very low. So they can't maintain their oxygenation with their normal breathing because much of their lung is actually solidified with the pneumonia. So the air exchange doesn't occur very well, and they are unable to maintain the oxygen levels that are required to maintain normal function. People can get cardiac complications. So some people get what we call a myocarditis, which is the inflammation of the muscle of the heart, which can present with a lot of heartbeat issues. That can be some palpitations, high heart rates, or even low heart rates. It can lead them to heart failure and a lot of breathing difficulties, which can then compound the pneumonia that's already there. Rarely, people can have neurological complications, which are mostly about confusion. So people can become very confused and they can become forgetful, and that can be part of the severe disease. Venous clots are the other thing. So clots in veins, particularly in the veins of the lungs, have been known to be quite common in severe disease. And they again add to the lack of oxygen that these patients have. So there's multiple reasons for people with severe disease to have very low oxygen levels, and they all have to be managed about the same time, so for the patient to get the best outcome. In addition, they're also prone to other bacterial infections, which can supersede the viral infection and therefore compound the disease even further. So as you can imagine, when people have severe disease, they really are very, very unwell. Next, please. Next slide. Yeah. So how do we control? How do we actually spread? So the main armamentarium that we have against preventing disease, particularly infectious disease, is to know how it spreads and what it does to our body and how does our body respond to it. So all these three factors will be the guidelines as to how to prevent an infection. So we know that it spreads through breath. So talking, coughing, sneezing increases the chance. So if you're sitting in front of somebody who, as I mentioned, the distance is, the rough guide is about 1.5 meters from each other. And if you've been together for more than 15 minutes, your risk is highest. So we know that if we keep that distance beyond 1.5 meters, if we don't have face-to-face contact without a mask on, and if we don't meet people too often, if we don't hug and we don't come too close, we can try and control this infection, isn't it? And the other way we know is now the virus does produce what we call antibodies in our body, which means our body does have a way of fighting the infection. It does produce this protein in this blood, which is against what are described as the S protein, the spike protein of the virus, which means the virus cannot attach itself to the human cell. And that is what we have used to produce vaccination. That information has guided how the vaccine is produced. So basically, what the vaccine does is presents either the antigen of the virus, which is the protein that produces that stimulates the body to produce the antibody, or the virus itself in an inactive form, so that we can then have more and more antibody in our blood and therefore not get infected with the virus. So the most important method of control, as we have seen in our country and in New South Wales and in world over, the higher the vaccination rates, the better the control of infection. So the prime method of control of this disease is and will remain vaccination. The other methods that will help, and one is social distancing, and we call this social distancing, but really we should call it physical distancing, so just a distance of more than 1.5 meters. Now, the importance of knowing that is also that when the government gives us guidelines of how many people can be in one room based on how much the distance should be to prevent any possible infection, we need to remember that just because it says you can be 20 people in this room, for example, to maintain the 4-meter square rule, it really does mean that those 20 people should be at that distance from each other. It's not that those 20 people should be then sitting in that room, but close to each other, then that doesn't help. So the distance has to be from each other, and the number is the guide of how many people can fit into a certain, room size with keeping that distance from each other. So remember, it's not just important to keep the number in mind, but also important to remember that you need to be far from each other. Use of face masks has been the most important way that we have controlled the spread of infection in hospitals and in public places. So even today, the simple guideline is when you're in crowded places, public transport, please wear your face masks. Washing hands is very important for controlling infection. Now, we do know that it's not as easily spread by touch as we first thought. So last year, everyone was totally consumed with the idea of washing hands and using hand sanitizers. We do know it's important, but not as much as we feared. And the other thing that we've all done is limited travel. So limiting travel does two things. One, it prevents crowding, so you're not sort of getting together in large numbers. And the second thing is it also keeps us away from areas that are still not very well controlled. So you don't go to countries or states where the risk of infection is higher than where we are. Next slide, please. Next slide, please. So this is just a cartoon to show what the government means, and they say how to avoid infection and spreading of the virus. So wash your hands often, and when you wash your hands, you must spend at least 20 seconds to wash each part of your hand, including the nails, the wrist, and in between fingers to be effective. Avoid touching your eyes, nose, or mouth, because that's where the virus is very likely to sit, and you're going to carry it on your hands if you keep touching these areas very often. If you're going to cough or sneeze, make sure you cover your mouth and nose. And these days we say, don't cough into your hands, cough into your elbow. And that makes it easy. Physical distancing, as I've already said, 1.5 meters is the rule, and that is how far the virus can travel in air. And if you keep your distance more than that, you are likely to be able to prevent the condition. Wear a mask when in crowded situations. Clean and disinfect frequently touched objects and surfaces, as we've mentioned. And then the very important part is to stay at home if you are feeling unwell. So if you are having any respiratory symptoms and you are worried that you may be infected, please stay at home to prevent your infection from spreading to others. Next slide, please. Just a little word about vaccines. All of you have heard a lot about it. The previous slide, please. Thank you. So there's a variety of vaccines that have been developed, and that was really great because we got the science of the virus structure very quickly, and a lot of laboratories and a lot of scientists worked together to produce the vaccines we could. And at one stage, there were about 600 candidate vaccines that were trying to be developed, and we know that we have about 10 by now that are known to be effective. The vaccines that are available in Australia are the AstraZeneca virus, which is a vaccine which is basically carries the antigen that needs to produce the antibody on another virus. So we actually basically inject another dead virus into the body, and which carries the protein that makes us produce the antibody against coronavirus. Then there are the two other Pfizer and the Moderna vaccines, which are similar methodology. So they are known as the mRNA virus vaccines, and this is just the way they are produced. And I don't think I need to go into the science of them. They both are quite similar in their effectivity, and they're both quite similar in their side effects as well. And because I'm talking to the Indian community, I must talk about the Bharat Biotech virus vaccine, which has also been shown to be very effective, and WHO has recognized it as a suitable vaccine for this condition. This basically has inactivated coronavirus as the part of the vaccine and has been shown to be highly effective as well. Next, please. What we can also do is, if someone is unvaccinated and is at risk of getting infection, we can actually give them antibodies as an injection into their bloodstream. So as you must have heard many times, when the virus infection first started, people were using what was known as convalescent plasma, which means that people who have had the infection in the past are likely to have antibodies against the virus. So if we use their plasma, then those antibodies will get injected into people, and maybe we'll be able to prevent infection. This was tried and not found to be very successful. However, what people could cleverly do was actually isolate the particular antibodies that are effective against the infection, and then produce those as a treatment rather than give the whole plasma, which may have diluted antibodies, and you can actually concentrate the antibodies and give them. What we use these antibodies for are people who are at high risk of infection and have either already had the infection or at a high risk of having infection. Within the first 4 or 5 days of acquiring the disease, in older people, in obese people, in pregnant people, people who've had other comorbidities, the people that I initially described as being at high risk of severe disease can then be given these antibodies, and what that will do is prevent these people from getting severe disease. So they've already had the infection, but for it to progress to severe disease, that's what we can stop by giving them these antibodies, which is known as passive immunization, which means you're not actively encouraging the body to produce antibodies, but you are just giving them antibodies from outside. Once they are better, then they can be actually given the vaccine in the future. Next, please. There are many other treatments that we have used for this condition. I don't think I need to go into too much detail. These are drug names that you would have heard that have been used for people with infection. The good news story that we need to talk about is just the last drug, the molnupiravir. That is a tablet that has been tried and found to be extremely effective in producing good relief from symptoms and preventing severe disease, and it should be soon marketed. Once we have the tablet available, maybe we will never see a patient who needs hospitalization. We can only hope for that. We don't really know that for sure, but it is supposed to be a very effective tablet against severe disease due to coronavirus. Next, please. So, other than the fact that it causes illness and people become very sick and they've had to be in hospital, and some of them, a lot of people have died, there are so many other issues that have been associated with this pandemic that the impact of which will probably be felt for a long time to come. The whole social distancing, the whole impact was not only to prevent the disease, but it also caused a lot of isolation. So people were shut up in their homes, they had no contact with the outside world, and particularly the vulnerable population of aging people, people who are very young, or people who lived in crowded homes. This impact will be felt for a long time to come. There has been a huge economic impact, as you know. People lost their jobs, people had businesses closed down, their educational opportunities became difficult, and all this has resulted in a lot of strife. And there has been a huge mental health impact of this condition and this whole pandemic situation, and on many, many people who may not have had the infection but are going to feel the impact of this pandemic for a long time to come. And there have been various reasons for that. As you know, there have been lockdowns after lockdowns, travel restrictions. So international families haven't been able to see their loved ones. People who became sick with coronavirus could not have visitors in the hospitals. So families have not been able to visit their sick family members. The unfortunate people who died without seeing their own loved ones have had no ability to say goodbye to them. Lots of educational opportunities lost, jobs and businesses, and the young families. And the biggest part of young families in lockdown was also coping with their working from home situation, and then also dealing with their young children's education. And that, I'm sure, could have been would have tried anybody's patience and mental situation. Next, please. Next slide, please. So really, the government has focused a lot on taking care of your mental health during COVID-19, and a lot of effort from societies such as ISC have gone into trying to maintain that contact with people, to keep in touch with friends and family, deliver them recreational material, food, groceries, etc., to not make them feel the isolation as much. And remember that it's a temporary situation. So just to remember that makes a difference. And there are also obviously a lot of mental health services that have been created in the community as well as hospitals by the government to look after these people in the future. Next slide, please. So what should we do now? So the first thing to remember, and we have done it very well in Australia, and we hope to continue to do that, is to vaccinate. So everyone has had a lot of people have had their first 2 doses. But remember, even the 5% who haven't had that is probably a large number of people still. So there is still a sizable population that's at risk of infection. So we are not going to see the end of this till that happens. And by now we know that people particularly who had the Pfizer vaccination must have a booster 6 months from their last dose. And those boosters have now started to be rolled out for the entire population. I would stay still, maintain safe distance. So whatever restriction of space is advised, particularly for the unvaccinated people, make sure you do maintain that safe distance. And also remember that the number limitation on the size of the room is not just the number, it's also how far you sit from each other in that room. Masks in crowded places are still to be recommended, particularly on public transport and in crowded, when you're attending concerts or theater, or you're going to be in a crowded marketplace, please do keep wearing your masks. If you're unwell, please stay at home. That prevents the infection from spreading. Get yourself tested as much as possible. And if you have the infection, then follow the public health guidelines as about isolation. And the isolation guidelines, as you know, are different for vaccinated people compared to unvaccinated people. And the reason for that is the vaccinated people are likely to have shorter disease compared to unvaccinated people. And if you have been identified as a contact, then the public health will contact you. It is very important to follow those guidelines to prevent yourself from becoming sick and from your other families and friends from becoming sick as well. I think that should be my last slide. Is there another one? Yeah, thank you. So that's the end of what I wanted to say, and I'm very happy to take questions from here. Can't hear you, Priyanka.
Thank you so much, Arjuna. It was such an informative session. And we, even though we know all these things, at times to get to know it together makes the most difference. I would still have a couple of questions for you that I really want to ponder upon. Firstly, is that we are hearing a lot about masks, putting on masks when we're traveling. I would like to understand from you that when, where, and how and why, of course, do I need to wear a face mask?
So the why is the easiest thing to answer. The why is because the virus spreads through breathing. So if you're wearing a mask, that protects the virus from that protects you from the virus entering your breathing system. So you prevent the infection by wearing the mask. Now, and the second thing to remember is it's actually distance really matters. So if you're sitting close to people, that's when the mask becomes even more important. Now, most of the time in our day-to-day lives, we are able to keep distance from each other, but there are situations where you won't be able to do that. For example, if you're in a crowded train, you're in a bus traveling to work or back, or you're in a crowded marketplace, or you're sitting in a theater, that's when you must keep your masks on so that even if you can't stay far from each other, at least that mask is the barrier. So masks are going to be here with us for a long period of time in those situations.
Yes, I think it's unfortunate that we'll have to continue wearing masks, but I think it's very important for us, given the disease can raise its head again, and we do not want
Yeah.
that.
Yes.
And the second question that I wanted to ask you is, the lockdown has eased up, so we are more freely communicating from one place to another. And if we are having visitors at home, so what can we do to make it more COVID safe?
So look, visitors at home, if you can choose, then have only vaccinated visitors. That's one important part. And often, but we can't really choose sometimes. But if you can choose, try and get, try and if people are that friends and family are not vaccinated, maybe you can be the champions of vaccination by explaining to them how you feel so much safer when you're vaccinated to do anything that you like. The other thing is, if you have visitors at home, I think there's no harm in asking them to use a hand sanitizer when they enter your home and when they leave, just for an additional precaution. That also makes people conscious of the fact that they still need to keep their distance. Avoid hugging as much as possible. We've come to know about elbow knocks and fist
Yes.
bumps. Those are some things, but it depends on where you are with that person and how safe you think they are anyway too. So I wouldn't say don't hug your loved ones, do, but just be careful about their vaccination status, etc., etc. And the other thing is, if anyone has a cold or a sniffle, that's the person to avoid. So just don't be shy of asking them to please not come, or if you are unwell, canceling your visitations, just to prevent that spread of infection. I think those are the small few things that you can do to help yourselves.
Yes, and a lot of us have again, started traveling for work. The offices are slowly opening up. The workplace is being more inclusive. So, what are the precautions that we can take when we are in there in an office setting, working or while traveling to work, Archana?
So, look, we do need to get back to our normal lives. It is very important that we do that, not only for our mental health, for our physical health, and for generally life to get back to normal, and for our economy and all that well being that we need. There are a few precautions, as some of them which I have mentioned. So, if you're in a public transport situation, please wear your masks. Make sure you sanitize your hands when you leave the bus or the train that you're traveling by. In offices, maintain your distance. The most important part of office spaces, most of us sit at our desks and work. We're not really extremely close to each other, but where it can go wrong is tea rooms and lunch places. So that's where people will take off their masks, often sit close together and chat. The talking can also spread the virus a bit more. So those are the situations where you need to be a bit extra careful. So make sure you keep your distance, sit in the same room, but just keep your distance, and that's what will help us.
Yes, I think our chat room discussion has to be a little more careful about. We have to
Yes,
take care
absolutely.
on that part. Yeah.
Yeah.
And Archana, if somebody is vaccinated
Mhm.
but still has shown COVID symptom, is still coming up with COVID symptoms, is it important to get tested, or because they're vaccinated, they can skip getting tested? What is your take on that?
So the short answer is yes, you must still get tested, because the what we know is that the vaccine is very effective against preventing severe disease. It is not 100% effective against transmitting disease. So you can still get infection, you can still transmit it. The one thing that it does prevent is your needing to get hospitalized. So you can, because you can still get infected, and there is a few people out there, particularly children these days, who are not vaccinated, and you can transmit infection to them. Anytime you have any cold like symptoms, please do get tested just to be safe.
Yes, and another opportunity that I think I should take at this time is to congratulate the state of NSW of getting
Yes,
over 90% vaccination, double vaccinations.
absolutely.
A lot of theories have come up about what are the symptoms of a rare side effect of myocarditis or pericarditis after a COVID-19 vaccine. I'm not a health professional, so I find these things very difficult to fathom of what it is exactly. If you can kindly share your views on that.
Sure. So, look, every medication and every vaccine does have its own potential side effect, and so does the COVID vaccine have its side effects. So, all of us heard a lot about AstraZeneca virus vaccine causing venous clots. I have to say that the risk was probably not as high as was hyped up, I would say. So the fear of the risk was higher than the actual risk. However, because we did lose a few unfortunate young people, everyone became very averse. And I think that was quite a difficult time for the country, because the people became very vaccine averse. However,
Yes.
I think the marketing strategy did improve, and the country did bring along some other vaccine candidates along into the market. Having said that, even the Pfizer vaccine and Moderna vaccine have their own side effects, and as you mentioned, the myocarditis and pericarditis complications. These are immune reactions that can cause some heart involvement, so heart muscle, and the heart covering is what is called pericardium. So any inflammation in those conditions, and mostly people will present with palpitations, they can develop some fluid around their heart, they can develop chest pain, and some insignificant, some very small number can also go into heart failure. Fortunately, what we do know is that it's a self limiting condition and it does get better by itself.
Mm.
Some people may need hospitalization and some steroids, etc., to control the symptoms. We have seen a few cases after Pfizer vaccine of myocarditis and pericarditis, but most have recovered. I think the next step is to then think of what if this happens after the first dose? What if it
Mm.
happens after the second dose and they need a booster? So far, our recommendation then has been to then use another type of vaccine and not the same one if they've had this complication.
Okay, okay. The name sounds scary. The effects are even more sometimes scary because we do
Mhm.
not have the full information with us.
Yeah, so it can be a bit scary, but most of the time, what I can say is most of the time it is a self-limiting condition and people do get
Yes.
better. Yes.
Yes, absolutely. And I was just reading somewhere the other day that you can get a itchy skin or a what do you call a skin scar, like that kind of a situation. Does is it common in a after a COVID vaccine that you get a itchy skin or you get rashes?
Not really. So you can get an allergy to any vaccine.
It-
So if you get an
hmm.
allergic reaction, the mildest form of it is the skin rash. So and usually it will subside. You can take some antihistaminics, so your carotene type tablet, which is simple to take, and that will usually get rid of it. Most of the most common side effect of the vaccine has been just pain at the site of the vaccine, but the skin rash can be part of an allergy that you can have to
Okay.
the vaccine, but it's not a very serious condition. But if you have allergy to one type of vaccine, then the next vaccine should again be a different one.
Yes. Archana, one of the most common vaccines that we are getting here in Australia is the Pfizer vaccine.
Yeah.
Is there any side effects to that Pfizer vaccine that we should be aware about?
So, like I said, the most common side effects are still really injection site pain, which gets better in a day or two, and the most significant side effect is what you just mentioned, the myocarditis and pericarditis. Other than that, we haven't heard of too much. You know, you can get a little bit of skin rash sometimes. Any allergy can develop because remember the vaccine doesn't just have the vaccine component; it also has something that has to carry the vaccine. So sometimes
Hmm.
you have an allergy to that protein or something, when then the option is then to use a different type of vaccine for the next dose. But
Okay.
the most important ones are the ones that I've already mentioned.
Okay, so what I could understand from this conversation is that, say, for example, if we had the first vaccine as a Pfizer and we had some minor issues with it, the next vaccine we can get a Moderna, say for example, is it possible?
You could. So if it's only been a injection site pain or a mild skin rash, you may still get the second dose of the same one. But if you've had myocarditis or pericarditis, then you wouldn't even take Moderna because that has the same side effect. Then you would
Okay.
probably take an AstraZeneca virus, a vaccine.
Okay. Okay. So our health professionals are fully equipped to judge that on basis and give individual recommendations
Yes,
for the
yes.
vaccines.
Yes, they are. And if you are worried, then it's always good to see a specialist and get advice. And there is actually a
Absolutely.
central, yes, there is a central website by the National Center of Immunization and Research that anyone can access, that you can put a question into and you will get a response. They have contact details on that website, and they also
Hmm.
list the most common vaccine side effects. So that's available for anyone to see.
See, fantastic. And can we have an anti-inflammatory medicine after taking a COVID-19 vaccine?
Yes, there is no reason why you can't. Most of the time, we would say just take a paracetamol for the pain, but an
Hmm?
anti-inflammatory is not contraindicated.
Okay. I have been hearing a lot about boosters. You have been talking about boosters in your
Yeah.
presentation. So, what is firstly, I would like to understand why is a booster needed? Why do we need to take a booster?
So we need a booster because what we see is that you get your primary. So we call it from the first two doses are known as primary vaccinations. So you get one dose and you get a second dose, and that's what brings up your antibody to protective level. But what we have
Hmm.
seen is that over a period of time, those levels start to fall. So that's when you get what we call the booster. So booster literally just means it boosts up your antibody response back to where it should be and then
Okay.
keeps it at that level. This is like getting your yearly flu vaccine. It's a booster.
Okay.
Every year you get one flu vaccine, and that's what protects you for that season. So
Hmm.
this is similar to that. So you get your two vaccines, which are the primary. So for both vaccines, the time duration, as you know, is a bit different. So 3 weeks to 4 to 12. And then the booster usually comes 6 months after the last dose. And that is only to so that it can lift up your antibody levels to where they should be.
Yeah, just another part of this question is that if someone needs to take a booster, that definitely doesn't mean that the vaccine is not working. We
Not at
do know
all,
the
not at
common
all.
myth.
Not at
Hmm.
all. So the vaccine is definitely working, but it's just the body's process that after a period of time, what we've seen is that those antibody levels start to come down. So what is recommended at the moment is, as I said, 6 months from the last dose, you should take a booster. And we don't know what will
Okay,
happen in the future. Maybe we'll have to take a booster every year. But we are learning as we go. This disease has taught us a lot. So next year we'll know
absolutely.
what we do after 1 year. Yeah.
Yes. And which vaccines, Archana, should we, be used for booster dose when we are going for one?
So at the moment, the vaccines that are available for booster doses are Pfizer and Moderna in this country. And it doesn't matter which vaccine you got prior to that, they're equally effective. So even if you got AstraZeneca as your primary vaccine, you can take a Pfizer or a Moderna booster. It will be equally effective. It has been shown and well studied. So whichever booster, these are the two that we have available at the moment, and these are the two that everyone will be offered.
Okay, so I have what I have realized from your conversation is that somebody with a little bit of an health issue has maybe opted for an AstraZeneca. So if the AstraZeneca booster is not available, is it safe in that situation to go for a Pfizer or a Moderna?
Yes, it is absolutely safe and it's quite effective. So any vaccination that you may have had primarily, both other vaccines as boosters will be equally effective.
Okay. And Archana, what is the difference between an additional dose and a booster? Are they both the same thing, or they're separate? Because the terms that we hear sometimes confuse us.
I look, additional dose is probably just a layman's term for booster. The additional dose is the booster. So you take
Okay.
your, like, the first dose and the second dose, they are the primary doses. They are essential because the first
Hmm.
dose doesn't produce as much antibody response as you need. The second dose is required. So those are the two primary. It's like, imagine taking your triple vaccine when you're a baby. Don't we get,
Yes.
so we get two doses and then you get a booster after 1 year. It's the same
Hmm.
principle. So you get your primary vaccine and then you get a booster after 6 months. The same principle as that vaccine.
Yes. Another thing is that when, say, for example, somebody is getting a flu vaccination and also getting a COVID-19 booster, is that completely safe to take both the vaccinations at the same time?
We recommend a gap of at least 2 weeks between the two vaccines. And part of the reason is
Okay.
that, you can get pain and fever with both vaccines. So you want to make
Hmm.
sure that you don't combine the two side effects. That's really the most major reason. Not that the vaccines interfere with each other, but you just want to make sure if you have any problem, you know which
Hmm.
vaccine caused the problem so that in the future you can decide which vaccine is good for you and which is not. So we do advise a 2 week
Absolutely.
gap between the vaccines.
Yes, and pregnancy. I like to talk to you upon that. I think
Mhm.
that's a very beautiful phase of anybody's life,
Mhm.
pregnancy. But
Yes.
that's also a little time to be very scared about, and because there is so much information going on in the market about how to take things. So, can a pregnant woman get the vaccine?
Yes, they can. So we didn't know that till early this year. So last year we were not so sure about pregnancy and the safety of vaccine. But since then, a
Hmm.
lot of studies have come across, and now we are actively vaccinating pregnant women at the same time. So it is very safe and it is actually essential because actually pregnancy puts you at a risk of getting more severe disease. So if you get
Hmm.
COVID-19 when you're pregnant, your risk of becoming very sick are quite high. So it's actually quite important for pregnant women to be vaccinated. And these are also the women, if they do get the infection, that we have given passive antibodies so that they can stay out of hospital.
Okay, and does it have any repercussions or anything on the unborn child, or can like that will be the first part of my question. Can that side effects like harm the unborn child?
Well, when we say it is safe in pregnancy, that's what we mean, that it is there is no evidence that it harms the unborn child. Otherwise, you wouldn't recommend it in pregnancy. So we, as I said, from the middle of this year, there have been lots of studies that have come out which show that it is quite safe for pregnant women.
Yes, and the most important part about a booster dose is how to get a COVID-19 booster dose. How is the government rolling out that option?
So when the vaccine, so look, some of the policies of the government have also depended on how much vaccine is available. So obviously, when the vaccine numbers are short, they first targeted the most vulnerable people. So initially, when the booster doses started, they were open only for severe immunosuppressed people and aged care people. But by
Hmm.
now, it's open to everybody because we have enough doses in the country. So anybody and everybody can get a booster.
Fantastic, fantastic. And another topic that I want to truly touch with you, because a lot of us have been going through this, which is the mental health.
Mm.
Apart from the direct repercussions, mental health has been a tremendous topic, and NSW government has been doing a tremendous job of keeping its morale high of the people who are in this state or in this country. So I just wanted to understand that, can COVID-19 lead to a mental and neurological complications?
So the virus itself, there's two things. So the virus itself can cause some confusion, etc., when it's in the acute illness, if it is severe
Hmm.
disease. But we don't know that it has any long-lasting effects on the brain or anything like that. However, the mental illness is much more related to the isolation that people have had to
Hmm.
go through and all the other impacts that it has had on their life. So people have lost jobs. People in hospitality business, for example, have really lost businesses. You all have heard about restaurants that have had to close. Airlines are sort of sitting on the ground. All the
Yes.
tourism industry is shut down. So those are the factors that have had a much larger mental health impact. And what we can hope for is that as the economy recovers, and I must say, we have been very lucky in this country that the government has been still able to give a lot of boost to the economy in many ways. People have been kept afloat. However, being shut down in your home, not being able to visit your family, all those things have their own impact. And just the self esteem of being able to work is different to being handed
Hmm.
money. So all those things have had a major impact. We are seeing that now. Having said that, I think the important thing is to make sure you stay in touch with family, stay in touch with friends. There's so much available now that can be virtual, and we can see
Hmm.
each other. It's so much easier. And I can tell you personally, my daughter's in London for 2 years. I haven't seen her except on a computer screen, and that has kept us going. So,
Hmm.
trying to sort of connect, try to stay connected, and also, but if you need the help, please, the help is there. Please use the helplines that are available. Use your GPs. Use their help to get yourself whatever you need.
Yes, I think what all of us need to do is fight it together and be united at this demanding time. And I'm sure we'll come out of this with flying
Look, I think we are on
colors.
the road to recovery now, so hopefully things will only look up from here.
Yes.
Yes.
Yes, the international travel, Archana, has opened up again, and it gives us a lot of joy. For a long time, we haven't been able
Yes,
to see our family, friends, loved ones across the
that is
borders.
true.
But
Yes.
but there are certain things that we need to keep in mind when we are traveling. So, what do you suggest when somebody is traveling on an airline? Does it increases the risk of getting a COVID-19?
Or look, no more than being in any other closed space. So make sure you. So I think the rules for travel are going to be quite strict to start with, and the airlines will also be watching out for vaccination status, symptoms, and as you know, all of us need to get tested before traveling, and you have to have your result within a certain period of time. All those are basically rules meant to protect us from infection. If possible, don't travel to high risk areas. There are some countries that still have a lot of disease. I think more than even that, it's what the worry is, if what the health infrastructure is like that. Will you get the same health care that you need in a certain part of the world if you do get an
Hmm.
infection? So getting an infection and then being able to look after it are two two things that need to be thought of when you choose where you travel to. So those are the few common sense things that will help. But by and large, I think all the rules set in place are to be should be followed, remembering that they are meant for our own protection.
Yes, of course, absolutely. And what kind of precautions should we take to protect ourselves when we are doing a long travel, uh, primarily by the airlines?
Look, I think if you're sitting very close to to any other passengers, keep your mask on. Try to keep your distance if you can. You know, keep your hand sanitizers with you. Don't share food. You know, simple common sense things that you would do in everyday life should be fine.
Okay. And somebody who has recovered from a COVID-19 recently, uh, is there a health risk if they are traveling after that time?
Look, somebody who's recovered from COVID 19, if they have no other symptoms, they are fine. They're actually probably the most
Okay.
protected people from any other complication. Having said that, we do know that some people will have long term symptoms after developing COVID, and they will have post COVID complications. And what we know this condition known as long COVID, if you've heard about it. Basically, it just means that
Yes.
in some people the symptoms go on for long, and we do suspect that some people who particularly who've been critically ill or who've required
Hmm.
ventilation, who've been in ICUs, may actually have some residual disease even after they recover. So those things are true, and those things are to be looked out for.
Wow, such a I think my questions you have answered so beautifully, and trust me, I go back more knowledgeable, more informed, and I feel our viewers will also feel the same way, because a lot of times we hear a lot of things, we do not know what to exactly believe in. Coming from a specialist like you, it does make all the difference in the world. And
Thank
Archana,
you.
our in fact our viewers have been flooding my page with questions, so I
I
will
see.
just like to put some for you. So some of them has written that mucormycosis, a potentially life-threatening fungal infection, is adding to India's COVID-19 related death toll. Is there any vaccine for that?
So, mucormycosis actually is a fungal infection that mostly occurs in diabetes
Okay.
patients and patients who've been on steroids. And the reason why India has seen a lot of it during the COVID 19 pandemic is because a lot of people have been treated with steroids, and India has a very high rate of diabetes among their
Hmm.
population.
Hmm.
So this and mucormycosis is also is a fungus that occurs in the environment, and there have been reports of perhaps contaminated oxygen cylinders, contaminated pipes that have been part of that process. It's actually a totally separate disease. It's not a disease that we have a vaccine for. It is difficult to treat because it can spread very rapidly, and it's very invasive. It can invade bone. It can get into the brain. People have lost vision, and it is
Okay.
known to occur in immune suppressed people. It's not particularly related to the COVID virus itself, but
Hmm.
probably a compounding of problems in the sense of maybe a diabetic having to take a lot of steroid for COVID and then having required oxygen, and therefore, if the oxygen cylinder is contaminated, inhaling that fungus and then getting that infection. But there is no vaccine. There is treatment. There are tablets and
Hmm.
injections you can give, but often they also need surgical treatment. So it is quite a difficult complication.
Okay. Another viewer of ours has raised a very, very important question, which I missed in asking you is
Mhm.
a lot of masks are available in the market.
Yes.
Any tips on which masks to choose?
So look, the effective masks are, what the common surgical masks that everyone is using, the blue masks with a white layer inside
Hmm.
and the ear loops. Those are really quite effective. But a lot of people have chosen to use cloth masks, which are fine too, particularly if they have layers. So the good thing to make sure is that there are two or three layers and not just a single layer of cloth. And the important thing about that is, of course, you can have your own individual mask, you can wash it with your normal laundry, but just use something that has more layers than just one. That's the important part.
Yes, of course. And Archana, another question that comes from my viewer is, what kind of vaccine is for the like for the kids under 12?
So all vaccines can be given to the under 12s. They are being rolled out by now for the 5 to 12-year age group is now being encouraged to get vaccinated. And the studies have come to say that these vaccines are quite safe for these people. So I think the next step in this country will be to vaccinate our younger children so that we don't have these school outbreaks anymore. So yes,
Yes.
any of the vaccines that are available, either of the vaccines that we have available in this country, can be given to kids under 12.
I think we have covered most of the topics that we could in this 1 hour. And again, thank you so much, Archana, for coming here today and speaking to me. I know some of the questions must have been repetitive, but
Okay.
I think that was important for my viewers and for the community at large. Thank you for
Thank you
being a
very
part of this show. And thank you for doing such a great work in the community. We are all thankful for that.
Thank you for having me. Thank you.
So, yes, I think we have all our questions answered for today. And I think we feel much more safer with safe information, safe knowledge, and no more confusions, I think, on that part. So, taking cue from that, I would really like to extend my warm thanks to the entire team who have worked behind the scene to put up this session. Again, thanks to Mr. Varigonda for working with so much vigor and so much enthusiasm in the community. We really need more people like you to make us feel proud as Indians in Sydney. So, thank you so much. And till then, be safe, wash your hands, keep a safe distance, maintain COVID protocols, and overall be sympathetic and empathetic as well. So, bye bye for today. See you again in some time.